Hi there. Thank you for joining me on the program, Your Doctor and COVID. I'm your host, Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to discuss the COVID-19 pandemic as it is still here, prevalent among us in Guyana. We have seen a number of persons being infected and a number of families have lost loved ones. So it continues to be a major issue that affects every aspect of our life, not just here in Guyana, but across the Caribbean and the rest of the world. As usual, I'm wearing my mask to cover my nose and my mouth, but I'll take it off for the remainder of this conversation. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. So we're in a different phase of our fight against the COVID-19 pandemic. Our greatest weapon that we have at this point is the COVID-19 vaccines. And we in Guyana have been using three types of vaccine. The Sputnik V, the V means victory, from Russia. We have the Sinopharm from China, and we have the AstraZeneca vaccine, which was developed at the University of Oxford, but can be produced in many places, including India. We have had a shortage of some supplies, so many countries that would normally produce and export these vaccines have actually had to retain vaccines for their own personal use in the face of rising numbers of cases in their own countries. And countries like ours that do not produce vaccines, and countries in the Caribbean and Latin America, we're actually at the mercy of the producers in order for us to get sufficient vaccines. But when we do get it, and we do have access to it, we want to strongly encourage that all eligible citizens and residents actually go and take the vaccines. We have been very fortunate in Guyana in that you can turn up to the vaccination centers and get your vaccine within a short time. And we have over 100 vaccine sites in Guyana. And we also do what we call raves. We have drive-by or drive-through vaccinations. We have location surges. People go to churches, mandirs, mosques, public spaces, and they can get vaccines there. These are all advertised in advance, and this type of practice has helped us. In our neighbors in the Caribbean and Latin America, they have not been that fortunate. In fact, there are some countries in Latin America that they have to wait several hours in lines in order to be able to get vaccines. When I say several hours, I talk about 6 to 8 hours sometimes. And so sometimes by the time these people get to the top of the line when it's their turn, vaccines are done. So we're very fortunate in Guyana that we actually have a supply of vaccines still. We're short right now on the second dose of the Sputnik V, but we still have AstraZeneca in abundant supply. We still have Sinopharm in abundant supply. There's a shortage of the Sputnik V because it's different from the first and the second dose. The first dose uses one type of adenovirus vector, and the second dose uses a second type of the adenovirus vector. So it's quite different, and that's why there is a shortage right now in face of rising cases in Russia. So they've been keeping back their vaccines for their own population. But once we get vaccines available to our population in Guyana, we strongly, and I personally strongly encourage that you should take your vaccines. The only group of person who should not take vaccine or who should have concern are persons who are known to have severe allergic reactions to vaccines in the past. A severe allergic reaction doesn't mean an itch on the skin or a bump. It means persons having difficulty in breathing, having had to go to emergency room before, needing adrenaline or admission to hospital. That's severe allergies. When it affects your breathing and there's your mouth and your throat and tongue are swollen up, that is severe allergy. Having itching and watery eyes, which are usually mild, does not constitute severe allergies. So the vaccines are still our best defense, our best weapon against COVID-19. And we see this play out across the world. In fact, just recently in the United States, we have seen credible publications that have shown that 99.5% of people killed by COVID-19 in the last 6 months were in the unvaccinated population. Just imagine that. 99.5% of persons who died did not have adequate vaccination. So quite clearly, if you look at that, there is a stark difference between vaccinated persons versus unvaccinated persons. 99.5% of the deaths were in unvaccinated persons. What is our local experience here in Guyana? So let us look at the last couple of months. Remember, we started our vaccination program in February of this year. So we do not really expect to see the effects of the vaccination program until like March, because remember, it takes about 2 weeks until you develop adequate immunity. So 2 weeks from your last dose of COVID-19 vaccine is when you're expected to have full immunity induced by the vaccine. So in March, we had 24 persons dying in the COVID ICU at Liliendal, and none of those persons were vaccinated, not even with a first dose. In April, we had 37 deaths in the COVID ICU at Liliendal, and none of the 37 persons had a single COVID-19 vaccine dose. So all 39 were unvaccinated. That's in April. If we look at May, we had 59 persons dying in the COVID ICU at Liliendal, and of those 59, 57 persons had no vaccine at all. 2 of the persons had a first dose AstraZeneca, and this first dose was within 1 week of receiving the vaccine. So they did not have enough time to develop any kind of immunity after the vaccine was given. In June, and now we're in the first week of July, in June we had 56 persons dying in the COVID ICU at Liliendal. Of those 56, 52 persons did not have a single dose of vaccine. 2 of them who died, unfortunately, had first dose Sputnik, 1 first dose AstraZeneca, and 1 first dose Sinopharm. So even in our local context, we see that the persons who are dying, greater than 95%, are persons who were not vaccinated. It is a dramatic number. It is too large to ignore and to think that this is coincident. There is definitely benefits to the vaccine. We are seeing it around the world, and here in our own little country, we can see the numbers reflecting that the deaths are seen in persons who did not get vaccines. So the other thing that contributes to mortality from COVID-19 is the comorbid conditions. And we all talk about comorbid conditions as being higher risk factors for death from COVID-19. Well, when we talk about comorbid conditions, we mean things like diabetes, hypertension, heart disease, kidney disease, other chronic infections, lupus, etc. So in January, we had 11 deaths in the ICU. 2 of the 11 had no comorbidities. It means, therefore, that 9 persons had significant comorbidities. In February, out of 14 deaths, 7 had no comorbidities. So it means that 50% of the persons had significant comorbidities. In March, 5 out of 24 had no comorbidities. So it means that 19 persons had significant comorbidities. In April, 36 persons would have died, and only 6 of them had no comorbidities. In May, 59 persons died, and only 3 had no comorbidities. In June, 56 persons died, and only 6 had no comorbidities. Now, I put this to you to highlight which group of persons are at highest risk. And therefore, these persons who are at highest risk must be and should be the ones who are at the front of the line to get their vaccines. Because to have comorbid conditions puts you at higher risk for getting severe COVID, for being admitted to the ICU, for being put on a ventilator, and eventually dying. Persons with comorbid conditions are at higher risk for these outcomes. So it therefore means that the persons with comorbid conditions should be lining up to get their vaccines as soon as possible. The diabetics, the hypertensive, the kidney disease patient, the cancer survivor, the known cancer patient, persons with chronic infections, with HIV, tuberculosis, persons with asthma. These are all persons who should be going to get their vaccines. These are not persons who should be afraid to get their vaccines, because these are the ones who are most protected when they get their vaccines. All of my cardiac patients, I would recommend that you go and get your vaccines. Regardless if you have had a heart attack sometime in the past, regardless if you're taking lots of medications, if you have heart failure, if you have a heart rhythm disorder, you are actually at higher risk for bad outcomes if you were to get COVID. So I encourage you to go and get the vaccine, so even if you do get COVID, it will protect you and you will not get the bad outcomes that you are potentially liable for if you did not take the vaccine. The biggest thing that we have been worrying about recently is the presence and the development of what is called COVID variants. We have seen several variants developed after the original strain was identified in China. We've seen the South African strain, we've seen the British strain, we've seen the Brazilian strain, and now we are seeing the Indian strain. These are all called variants, and we have labeled them alpha, beta, delta, gamma. Now, the main one that seems to be running wild recently is the Delta variant, which was first noticed and became a variant of interest in India. Now, India has 1.3 billion people, so it is not surprising that a virus that is rampaging across that population can mutate or develop variants in order to survive. Now, that's what viruses do, not just COVID-19 virus, but many other viruses. The flu virus that people get on a yearly basis. In order for the virus to survive, it actually mutates, it changes, it develops variant strains. And each strain has some strengths and weaknesses. We know that the variants, they all seem to use the same mechanism to attach to human cells in order to cause problems. So they attach by spike proteins, and these spike proteins allow them to gain entry into the human cells, and once they get entry there, that's when they cause problem. And this is exactly why all of the vaccines target the spike proteins. So if you target the spike proteins, regardless of which variant presents itself, you are still protecting the patient by vaccinating them, because the vaccines produce antibodies that prevent the spike proteins from attaching to normal cells. So I hope this would encourage you again to take your vaccines, and also empower you to encourage those around you to go and get their COVID-19 vaccine. Remember, if you have any questions or comments, please feel free to send a WhatsApp to 620-6275, or you can send an email to docandcovid@gmail.com. Thank you once again for joining me.